Cervical cancer screening and prevention. Cervical cancer is a significant health concern for women worldwide. It primarily affects the cells of the cervix, the lower part of the uterus that connects to the vagina. Early detection through regular screening and preventive measures can significantly reduce the incidence and mortality of cervical cancer. This video explores the importance of cervical cancer screening, various screening methods, prevention strategies, and additional tips for maintaining cervical health. Understanding cervical cancer. Causes and risk factors. Cervical cancer is most commonly caused by persistent infection with high-risk types of human papillomavirus, HPV. Other factors can also contribute to the development of cervical cancer, including multiple sexual partners, increases the risk of HPV infection. Early sexual activity. Exposure to HPV at a younger age can increase risk. Weakened immune system conditions like HIV, AIDS can make it harder for the body to fight off infections, including HPV. Long-term use of birth control pills. Associated with an increased risk of cervical cancer. Importance of cervical cancer screening. Regular screening can detect precancerous changes in the cervix, allowing for early intervention and prevention of cervical cancer. Screening is essential for women as it helps identify abnormalities before they develop into cancer. Screening methods. Pap test, Pap smear. The Pap test involves collecting cells from the cervix and examining them under a microscope to look for abnormalities. During a pelvic exam, a healthcare provider uses a speculum to widen the vagina and collect cells from the cervix using a small brush or spatula. Women aged 21 to 65 should have a Pap test every 3 years. Women over the 30th of May choose to have a Pap test combined with an HPV test every 5 years. HPV test. The HPV test detects the presence of high-risk HPV types that are most likely to cause cervical cancer. Similar to the Pap test, cells are collected from the cervix and tested for HPV DNA. Women over 30 can have an HPV test every 5 years, either alone or in combination with a Pap test. Preventive measures. HPV vaccination. The HPV vaccine protects against the types of HPV that most commonly cause cervical cancer and genital warts. The vaccine is most effective when given before exposure to HPV, typically recommended for girls aged 11 to 12. But can be given as early as age 9 and up to age 26, and sometimes up to age 45 after consulting with a healthcare provider. Types of vaccines. Gardasil 9 protects against 9 HPV types, including 7 that cause cervical cancer and 2 that cause genital warts. Cervarix protects against 2 high-risk HPV types, 16 and 18. Safe sexual practices. Using condoms consistently and correctly can reduce the risk of HPV transmission, although they do not provide complete protection. Limiting sexual partners. Reducing the number of sexual partners can decrease the risk of HPV infection. Smoking is linked to an increased risk of cervical cancer. Quitting smoking can improve overall health and reduce this risk. Seek support from healthcare providers, counseling, and smoking cessation programs to quit smoking. Regular health checkups. Regular pelvic exams and health checkups can help monitor cervical health and address any concerns promptly. Follow up on any abnormal test results with further testing or treatment as recommended by your healthcare provider. Healthy lifestyle. A diet rich in fruits, vegetables, and whole grains supports overall health and can help maintain a strong immune system. Regular physical activity boosts immune function and overall well-being. Staying hydrated is important for overall health, including the health of your reproductive system. Educate yourself and others. Stay informed about cervical cancer, HPV, and the importance of screening and vaccination. Share information with friends and family to promote awareness. Advocacy. Support initiatives and organizations that promote cervical cancer screening and prevention. Cervical cancer screening and prevention are crucial components of women's health. Regular Pap tests and HPV tests can detect precancerous changes early, allowing for timely intervention and reducing the risk of cervical cancer. Vaccination against HPV, safe sexual practices, and a healthy lifestyle are key preventive measures. By staying informed, attending regular health checkups, and adopting healthy habits, women can significantly reduce their risk of cervical cancer and maintain optimal cervical health. If you received value from this video, please like, subscribe and comment.